If you've been taking blood pressure medication for months or even years, and your numbers at the doctor's office look fine, you might assume everything is under control. But here's something many people don't realize. It's entirely possible for your blood pressure reading to look perfectly normal, while your medication isn't actually doing what you think it's doing. And by the time most people notice something is off, it's often because of a symptom they brushed aside as just getting older. Today, we're going to walk through 3 signs that your blood pressure medication may not be working the way you assume, why these signs are so easy to miss, and what you can do about it. Stick around, because the second sign surprises a lot of people, since it can actually feel like the opposite of high blood pressure. Before we get into it, let's take a moment to understand why this topic matters so much, especially for anyone over 60. High blood pressure is often called the silent condition because it usually doesn't come with obvious symptoms. That's exactly why so many people rely completely on their medication and their yearly checkup to tell them whether they're okay. But blood pressure isn't static. It changes with stress, sleep, diet, other medications, and even the time of day. A pill that worked perfectly for you 2 years ago may not be working the same way today. Your body changes, your lifestyle changes, and sometimes, without any dramatic warning, your treatment plan quietly falls out of step with what your body actually needs. This isn't about causing alarm, it's about awareness. Millions of people take blood pressure medication every single day, and for most of them, it plays an important role in protecting their heart, their brain, and their kidneys. The goal today isn't to make you second guess your doctor or your treatment. It's to help you notice patterns your body might already be showing you, so you can have a more informed conversation at your next appointment. Think of this less like a warning and more like a checklist for peace of mind. Let's start with the first sign, and it's one that catches a lot of people off guard because it seems to contradict common sense. Sign number 1 is when your blood pressure reading looks good at the doctor's office, but you don't actually feel like yourself. Maybe you still feel tired in ways that don't make sense. Maybe you get occasional headaches or a foggy feeling in your head, especially in the afternoon. Maybe your ankles seem a little more swollen than they used to be. On paper, everything looks fine, so it's easy to explain these things away as normal aging, poor sleep, or stress. But here's the piece of the puzzle that often gets missed. A single blood pressure reading taken in a doctor's office is like a snapshot. It shows you one moment in time, but your blood pressure moves throughout the day, sometimes quite a lot. This is where something called masked hypertension comes in. That's just a medical way of saying your blood pressure looks controlled at the doctor's office, but it's actually higher at other times of the day, like early morning or late at night. Picture it like this. Imagine your blood pressure is a highway, and most of the time traffic flows smoothly. But there are a couple of hours a day when there's a traffic jam nobody sees, because no one happens to be checking during that time. Your doctor's visit is like taking a picture of the highway at 2 p.m. when traffic looks calm. But if the real congestion happens at 6 a.m. when you first wake up, that picture doesn't tell the whole story. This matters because a lot of the health risks connected to high blood pressure, like strain on the heart, blood vessel damage, or increased stroke risk, are linked to these hidden spikes, not just the number your doctor sees every few months. This is one of the reasons many physicians now encourage patients to check their blood pressure at home at different times of the day, rather than relying only on the office visit. If you've been feeling occasional symptoms that don't seem to match your normal reading, this is worth mentioning to your doctor, and it may be worth tracking your numbers for a week or two, in the morning and again in the evening, so you can see the fuller picture together. Now here's a curiosity loop worth sitting with for a moment. The second sign we're going to cover often feels like the complete opposite of high blood pressure, and it catches people off guard because they assume if their medication is working, they should feel steady and strong. But sometimes the medication can overcorrect, and that comes with its own set of warning signs. Sign number 2 is feeling dizzy, lightheaded, or unsteady when you stand up, especially first thing in the morning or after sitting for a while. Many people assume this is simply a normal part of aging, something to expect once you hit your 60s or 70s. And while it's true that our balance systems do shift somewhat as we age, this particular symptom, especially when it happens consistently, deserves a closer look, particularly if you're on blood pressure medication. Here's what's happening in simple terms. When you stand up, gravity pulls blood down toward your legs. Your body is supposed to respond almost instantly by tightening blood vessels and increasing heart rate slightly to keep blood flowing properly to your brain. It's an automatic reflex, kind of like how your pupils adjust when you walk from a dark room into bright sunlight. But if your blood pressure medication is a little too strong for your current needs, or if the dose isn't timed well with your daily routine, this reflex can be dulled. Blood pressure drops more than it should when you stand, and for a few seconds, your brain isn't getting quite enough blood flow. That's what causes that woozy, lightheaded feeling, sometimes even blurred vision, or a brief sense of your legs feeling weak. This condition even has a name: orthostatic hypotension, which simply means low blood pressure that happens specifically when you change position, like moving from sitting to standing. Picture your blood pressure like water pressure in a garden hose. If the pressure is too low, when you suddenly point the hose upward, the water barely makes it out the top. Something similar happens with blood trying to reach your brain when your blood pressure drops too quickly upon standing. Now, why does this matter so much for older adults specifically? Because this single symptom is one of the more common, preventable contributors to falls. And falls, as many of you already know, are one of the biggest threats to independence after 60. A fall doesn't just cause a bruise. It can lead to hip fractures, hospital stays, and in some cases, a long road to recovery that affects mobility and confidence for months or even years. So if you've noticed this kind of dizziness, especially if it's become more frequent recently, it's not something to just push through and ignore. It's worth discussing with your doctor because it could mean your current medication or dosage needs a second look, not because something is dangerously wrong, but because your body may be telling you it needs some fine tuning. Before we move to the third sign, let's pause and connect these dots. Both of these signs share something in common. They both remind us that blood pressure isn't just a number captured once a year. It's a living, moving part of your body's daily rhythm. And that brings us to our third sign, which is a little different from the first two, because this one isn't about how you feel physically. It's about something almost everyone overlooks, and it has to do with the little details surrounding how the medication is taken. Sign number 3 is when other parts of your daily routine are quietly working against your medication without you realizing it. This might sound less dramatic than dizziness or fatigue, but it can be just as important. Many people picture blood pressure medication like a light switch. You take the pill, and it flips a switch that controls your blood pressure for the rest of the day, no matter what else is going on. In reality, it works more like a thermostat that's constantly being influenced by other factors in your environment. Let's walk through a relatable example. Imagine George, a 68-year-old man who's been taking blood pressure medication for the past 3 years. His numbers have generally been decent, so he hasn't thought twice about his routine. But recently, he started taking an over-the-counter pain reliever almost every day for some knee discomfort. What George doesn't realize is that certain common pain relievers, particularly a group called NSAIDs, can cause the body to hold on to more sodium and fluid, which can quietly raise blood pressure and, in some cases, make blood pressure medication less effective. George isn't doing anything wrong on purpose. He simply doesn't know that these two things are connected. This is incredibly common. Many people don't realize that certain over-the-counter medications, decongestants, some supplements, excess salt intake, or even inconsistent timing of when the pill is taken can all interfere with how well blood pressure medication works. Alcohol is another factor that can play a bigger role than people expect, sometimes amplifying the blood pressure lowering effect too much, and other times contributing to spikes, depending on the amount and the individual. Here's a simple way to think about it. Your blood pressure medication is like one instrument in an orchestra. If it's playing beautifully on its own, that's great. But if other instruments, your diet, your other medications, your stress levels, your sleep, are playing out of tune, the whole performance can sound off, even if that one instrument is doing exactly what it's supposed to do. This is why it's so important to bring your entire list of medications and supplements to every doctor's visit, even the ones that seem unrelated or harmless. Many people don't think to mention an occasional ibuprofen or a daily multivitamin, but these details can matter more than they seem. Now, let's talk about what you can actually do with all of this information, because understanding these three signs is only useful if it leads to practical action. First, consider keeping a simple blood pressure log at home for a week or two, especially if you've noticed any of the symptoms we've talked about today. Measure it in the morning shortly after waking, and again in the evening, ideally at similar times each day. Write down the numbers along with anything unusual you noticed, like dizziness, fatigue, or headaches. This gives your doctor real information to work with, rather than a single number from one office visit. Second, if you experience dizziness upon standing, try standing up more slowly, especially first thing in the morning. Sit on the edge of the bed for a moment before standing fully. This isn't a fix for the underlying cause, but it can reduce your risk of a fall while you and your doctor figure out what might be adjusted. Third, make a habit of reviewing everything you're taking, prescription medications, over-the-counter products and supplements with your doctor or pharmacist at least once or twice a year. Bring the actual bottles if that helps. Pharmacists in particular are an excellent, often underused resource for catching these hidden interactions. Fourth, pay attention to consistency. Taking blood pressure medication at a similar time every day helps maintain steady levels in your body rather than causing a stronger effect followed later by a weaker one. And fifth, don't dismiss subtle symptoms just because your last blood pressure reading looked fine. Fatigue, mild headaches, occasional swelling, or dizziness are worth mentioning to your doctor, even if they seem minor. You know your body better than a single number does. Now, I want to be very clear about something important. Nothing in this video is meant to suggest you should adjust your medication dosage on your own, skip doses, or stop taking anything without guidance. Blood pressure medication plays a critical role for many people, and even small changes should always be made under the supervision of your doctor. What we're talking about today isn't about second-guessing your treatment. It's about becoming a more active, informed participant in it. Doctors rely heavily on the information patients bring to appointments, and the more details you can share, the better decisions you can make together. If you experience sudden, severe dizziness, chest pain, difficulty speaking, sudden weakness on one side of the body, or a blood pressure reading that's extremely high or extremely low, that's not something to monitor at home and wait on. That calls for prompt medical attention, and it's always better to be cautious in situations like that. Let's bring everything together. Blood pressure medication is an important tool, but it isn't a set it and forget it solution. The first sign we talked about was having a normal-looking reading at the doctor's office while still experiencing symptoms like fatigue or headaches, which may point to hidden fluctuations throughout the day that aren't being captured. The second sign was dizziness or lightheadedness upon standing, which could mean your blood pressure is dropping too much at certain moments, increasing your risk of falls. And the third sign was more indirect: everyday habits, other medications, or dietary choices that quietly interfere with how well your treatment works, without you ever realizing the connection. None of these signs are meant to frighten you. If anything, they're meant to empower you. You don't need to become a medical expert to protect your health. You simply need to pay a little more attention to the patterns your body shows you and bring those observations to the people who can help you interpret them properly, your doctor and your pharmacist. Healthy aging isn't about perfection. It's about awareness, small adjustments, and staying engaged with your own care instead of assuming everything is automatically fine because a pill bottle says take once daily. You've already taken an important step today just by learning what to watch for. Now I'd love to hear from you. Have you ever experienced dizziness when standing up or noticed symptoms even when your blood pressure reading looked normal? Let us know in the comments, and if you feel comfortable, share your age and where you're watching from. Many people in this community find comfort in realizing they're not alone in these experiences, and your comment might be exactly what someone else needs to see today. If this video helped bring some clarity, consider sharing it with a friend or family member who's also managing their blood pressure, because sometimes the most valuable health advice comes from a place of care, one person passing along useful information to another. Thank you for spending this time with us today, and we'll see you in the next video.